Our first speaker is Dr. Chip Howard from the University of North Carolina, who's going to be talking about the Rare Disease Connect Network in Neurology.
Thanks, Mike, and thanks to the organizing committee. I'm starting to lose my voice. I hope it stays. We're going to change gears. We're not going to talk about therapeutic science. We're going to talk about education and speak about RDCN. These are my requisite disclosures. So think back 10 years, 15 years ago. How did you learn about myasthenia? Actively, through your mentors, your colleagues, through literature, passively, sleeping and letting it infuse through the brain? Were there clear learning objectives identified in those instruments that you used to learn? And did you have time to connect with colleagues to discuss this? I would suggest that many of you did not, that there weren't venues for you to learn about myasthenia gravis at the time. In 2007, the New England Journal of Medicine published a seminal paper examining the cause of obesity, and it produced clear and robust findings. It was not an intervention, it was not a drug, it was not a surgical procedure, nor was it a design of the health system. And one wonders, what was that recommendation? And it was networking. And networking demonstrated that education and understanding could be amplified and magnified through the network process. And is subsequently known and found that it's very critical in terms of our clinical and public health interventions. And so in 2020, a learning needs assessment was undertaken by UCB, and whom I'm representing here today. A literature search was performed between the periods of 2009 and 2019, and there was exceptionally little information on the learning needs and the professional practice gaps dealing with myasthenia gravis. Interviews occurred with MG experts around the world at that time, and there was minimal to no networking spaces for collaboration for GMG. And there was a lack of high quality, needs-driven, outcome-focused educational material for myasthenia. Because of this, a team was put together to develop a lifelong, what we would consider transformational learning process. The goal was to foster a global network of experts to impart educational material to clinicians around the world, to not only HCPs, but patient care organizations, ultimately to the patient themselves. The ambition was based on to improve the evidence-based practices and patient outcomes, to raise the bar for transformational interprofessional learning, to transform collaboration among peers, and to accelerate the adoption of translational medicine in rare neuromuscular disorders. And the model that is used in the educational settings is based on this. A logic model, and speaking with educational experts, was outlined here. But it doesn't go in this fashion. You actually start at the end and you work backwards. What's the impact that you want? What are the outcomes that you're going to measure? What are the metrics that you'll use to assess how well we've done? What are the activities that we're going to use? And then what resources and inputs do we have? And as you plan backwards and develop this, you then implement in a forward process. And this is what's been done with a program that I'm going to discuss with you. the benefits, collaboratively creating this logic model, and I'm not an educational expert, and it's not my field, through multiple stakeholder programs was to create shared understanding and focus on this long-term program. Out of that came what we call Rare Disease Connect in Neurology, RDCN. We have put together an international steering committee. You can see them here. We cover 3 major continents with Kimiaki in Japan, colleagues in Europe with Heinz and Renato, and then 3 of us from the US. Our goals were to describe the latest research into the basic immunology of myasthenia, the recent insights into pathophysiology from neuromuscular destruction via complement, for instance, to repair, to assess patient needs, their disease burden, and to work collaboratively with patients and their PAGs, their patient advocacy groups, to look at holistic approaches to their experience, to closely partner with other groups involved in this, to identify patient populations that may be challenging, unmet needs, for instance, to look at best practices that are out there, and then to explain the potential value of this kind of a program to all that were involved. This took a while to define and to develop, and then we routed it through best educational practices for MG, focusing on the patient pathway, pathogenesis and diagnosis, clinical engagement, clinical management, and then patient care. And we did this through a variety of discussions, through audience voting, through real-world scenarios, and then reflective questions, and fed all of this back in as we modified and evolved the programs that we have presented over the years. We set this as a 10-year ambition to develop this lifelong transformational model to the global community. We wanted to reach the international groups from all continents, and that we're currently expanding that, and to have regular evaluations of this product to modify, to adapt, to expand, to contract over the short term as well as the long term, as you see listed here on the right. Our first meeting is in 2021. It was a 3-day virtual meeting, and some of you may have attended that. I will tell you, we ran this simultaneously on 3 continents, Asia, the Americas, and Europe, and we floated topics in and out based on the time zones so that everyone heard everybody else at the time. And it was a testament to the organizing group led by Michelle McKechnie and Sophie Berry and her team. In 2022, we met in Madrid for a 2-day meeting that was hybrid, and you can see the numbers who attended there. And then last year we were in Berlin, and this year we'll be meeting in Amsterdam in November, as you can see on the 14th and the 15th. The model incorporates feedback and recommendations and critiques, and you can see that we've scored fairly well in all of this, that people found it useful from an educational perspective, from generating new ideas, changing practice patterns, if you will, and it went over quite well. These are some of the comments that we've encountered through the participants. In the lower right, blown away does not refer to Netflix reality show of blowing glass, and I'm a glass blower, but this is one of the comments made. So we're delivering on our ambition. We've created a digital community now, in addition to the on-site meetings that we've had, that one can log into, and I will give you QR codes to look at or to photograph and connect with. But through a variety of case study videos, panel discussions, webinar series, infographics, other webinars, e-learning modules, etc. And they've spanned a variety of topics. One of the ones that I was involved with was having an hour conversation with Gavin Giovannoni from London, talking about the similarities and disparities with MG and multiple sclerosis, and his development of the brain health paradigm, bringing together stakeholders of all kinds, from regulatory affairs and government down through the patient and everyone in between, developing white papers to move forward. And it's the subject of a call to arms manuscript that will be forthcoming to see if we can do the same in myasthenia gravis. We are delivering with this lifelong learning. We run parallel now patient organization meetings simultaneously so that we can interconnect and intertwine with them. We're continuously updating the healthcare providers' needs, learning needs, etc. We've run hub meetings simultaneously and asynchronously, both in Japan and the United States, and we'll talk about the US in a minute. And we're continuing to expand this virtual community. The problem, as I said earlier, was the lack of robustly defined needs-driven and underscore needs-driven education for the MG community, for the clinicians. And the solution was Rare Disease Connected Neurology, RDCN. And we've patterned that into evidence-based educational practices. We shape it by the needs of the patient community, for the patient community. We now have over 500 registrants in this educational program with a wide-ranging needs-driven educational resources that one can use. This is going to be expanded. We're moving from myasthenia alone now into MOG and TK2D within the year. Where are we going? In April, we will have a US-based meeting because of the regulatory difficulties of inviting US practitioners to Europe and all of the regulatory restrictions. So we will have satellite meeting in the US in April. The date has not been defined, but it'll be in association with the Academy of Neurology meeting. And if you click the QR code, we'll register you and then send you information as we develop it. If you want to be a part of this global community, there are brochures at any of the UCB tables. There's one out by the entrance. There's another one right out here. I have some on my desk, but just click on the QR code and it will take you to it. Thank you very much.
We have a few minutes for questions.
Chip, can you talk a little bit about the reception from the patient advocacy organizations? Because I feel like in some cases, the advocacy organizations see a big role of their existence in terms of like educating both patients as well as clinicians. So,
yeah, there are advocacy organizations who believe that that's their only role and feel threatened by it. We see this as a joint venture. These advocacy organizations have been a part of our program. Last year, for instance, CEOs of several of them we've used them as speakers. We believe this is a partnership that we can give and take and involve both parties. And so I don't see it becoming a real issue. We're not out promoting the drug. This is all drug agnostic. It's basic science, clinical science, clinical management in the global perspective. But I hear what you're saying, but it's not been an issue. It seemingly has gone over very well.
Great talk and great project. Is there opportunity for additional education of allied health providers, such as nurses, nurse practitioners, as part of the existing structure? Is that planned?
Yes. No, there is actually a nursing organization that's running simultaneously that has just recently been created and will become an integral part of this all going forward. It's critical to involve. I remember chairing a roundtable discussion 2 years ago when we were in Madrid, and we were talking about educational materials for MG patients. And I said, well, MGFA has all these brochures. They're readily available on the web. And the woman from Romania said, my patients don't speak English. You know, very obvious. And so the opportunities because of this are now moving to the translational or the translation of multiple educational products across all venues so that we can reach global communities. But this is the kind of thing that has identified these needs that we can now work as a group, as a team, in moving forward.
Great, thank you, Chip.